So I lead advocacy and science policy for the Every Life Foundation. I'm also wearing my RDLA hat today, which is a program of the Every Life Foundation. And I'm going to be talking about something that was discussed earlier today, something called the 21st Century Cures Act, and I'm going to kind of give you guys an update about that and tell you what the current state of play is around that piece of legislation. How many of you, so has everyone heard of this bill before? Can you raise your hand if you have? Okay, awesome. So this bill came about from Chairman Upton and Congresswoman DeGette. It was bipartisan from the beginning. They spent over a year sort of gathering input from stakeholders and really thinking about how to put a large piece of legislation together that would benefit the entire sort of biomedical community. So very, very ambitious thing that they were able to do. As I said, they spent over a year getting all this together, actually put out 4 draft bills. So they put everything together in what we call sort of large omnibus legislation. And there was so much in there that I just can't discuss everything that was in the bill today because it was over 400 pages. There was a lot of things of importance to the rare disease community in the legislation. And I'm going to go through some of them, but we're going to hear about them in more detail from some of our panelists. So one of those things was something called the Open Act. There was language in there that would actually help improve biomarker qualification at the FDA. Also language in there that would help with the FDA workforce, basically help ensure that the FDA has the best people and that can keep the best people there, which is incredibly important for drug review, and this is especially true in the rare disease space. So on top of that, there was billions in new funding for the NIH as well as the FDA. And then there was an extension of the Priority Review Voucher Program. There was a bill called the Neurological Disease Surveillance Act, as well as language around compassionate use. And lastly, but not least, patient-focused drug development. So these are some of the rare disease priorities that were in the 21st Century Cures Act. This is not comprehensive. This is really just some of the top priorities for our community. And I'm going to talk a little bit about how this bill moved through the legislative process, and I'm actually going to talk about it using some pictures and tell it through the eyes of another Max, a much smaller, more adorable version of me, Max Schill, who's 7 years old and whose mom is one of the leaders in putting this conference together. So if I screw this up, Lisa, you can correct me. So the bill started out, just like all bills do, it started in committee, and you can see Max here with Chairman Upton and Congresswoman DeGette. This bill flew through the committee. It was a completely bipartisan and totally unanimous vote, which does not happen every day in Congress. So this was really an amazing victory for patients. And then the bill went on to the floor, and you can see this is Max here outside of the cloakroom, which I'm not sure how he got there, because he's really not supposed to be there, but somehow Max used his cute powers to get down to the floor for the vote, which, yeah, does not happen very often. And so when this bill went to the floor, this was a very, very bipartisan vote. You can see 344 votes yes, only 77 opposed. So again, a very bipartisan moment. And how many of you actually took action on 21st Century Cures when this vote happened? So that's awesome. Thank you, guys. You guys, you made this vote possible, so thank you for doing that. And then after the bill was passed, Max went back for sort of like a victory lap, I guess we could say, and he went to see Congresswoman DeGette, and this was him here, and she actually like interrupted a hearing so that Max could sit in the big seat, and this was actually on C-SPAN, so it's kind of cool. And then for the efforts that Chairman Upton made, as well as Congresswoman DeGette, they both won Rare Voice Award from RDLA, from the foundation, so that was given to them in recognition for all their efforts around cures and for all that they have done for the rare disease community. So we're very grateful to them. But this is the path forward. So right now, the Senate is currently weighing this legislation. They have to come up with some companion to what was done in the House. And assuming they can do that, the bills will then kind of get pasted back together, which is called, they'll get engrossed. And then they'll go to conference committee, which is where the House and the Senate versions will have to be reconciled in some way. So that should be an interesting process, and then ultimately the finish line is the White House. So we want this to happen as soon as possible, of course. In terms of the Senate process, they've taken a very different approach than what the House has done. So they're doing more of a piecemeal approach. So they're trying to pick out individual bills that were passed as part of the House's larger legislative package, and they're trying to pass those individual bills on a sort of one-off basis. And so what they've already done, they've scheduled a total of 3 hearings, one of which has already occurred. The first hearing that happened, they've passed several bills in that, including 2 that were priorities for the rare disease community, one of which was the Advancing Targeted Therapies Act, which, again, that was passed at the committee level in the Senate. And then the Advancing Neurological Diseases Act was also passed. However, there was language that was inserted in there that would actually limit that bill to only the top 5 most prevalent diseases in the country. So that effectively stripped it of the provisions that would impact the rare disease community. So that's a major concern for us, and we're hopeful that we can see that language put back in during the conference process. And all of these bills were actually passed unanimously, done by voice vote. The next hearing is scheduled for March 9th, and we know that at least 2 pieces of legislation that are of interest to us will be in there. One of them is the Advancing Hope Act, which is about the Priority Review Voucher Program, and the other is about the Precision Medicine Initiative that we've heard so much about from the White House. So what's not currently on the table for the Senate to consider? First of all, there was no bill introduced on the Senate side about compassionate use. So we haven't seen any sort of movement or action around that. I think there's pretty bipartisan agreement about increasing funding for NIH and FDA, but in true congressional form, they can't decide how to fund that increase. So everyone wants the same thing, they're just not sure how to do that yet. So that's one thing that we want to see happen on the Senate side. You'll hear more today from Annie about the Patient-Focused Impact Assessment Act that has also not been scheduled for consideration, and the Open Act, which is a bill that I know many of your organizations have signed on to endorse, was also not slated for consideration. So we basically have one last shot to get these bills heard by the Senate, and that's for this hearing that's scheduled for April 6th. And so if we want all of our priorities to be included, we need to make sure the Senate gets this message loud and clear tomorrow, and when you guys go to the Hill and actually meet with all of your senators and your representatives. So the reason we need to do this, there's quite a lot of distractions this year. Obviously, we have a highly entertaining presidential race happening, but because it's an election season, it's quite limited the amount of time that the Senate will actually be in session doing their job of legislating, because so many of them are actually out campaigning right now, and this is true for the House as well. So that's a major distraction, and that means there's less time for the Senate to do what they need to do to get this bill done. And of course, we have the Supreme Court controversy coming up as well. So this is another huge distraction that's facing the Senate and Congress more broadly. So the way we make things a priority is by getting in Congress's face in the most polite way possible, of course, and telling them that this needs to be a priority for the community. It needs to happen now. So one of the tools that we have for actually raising our voice and raising visibility of our issues in Congress is the caucus. The caucus was recently expanded to the Senate, which we're very proud of and happy about, and you'll hear more about that from Molly. So today, I mentioned that we'll be covering some of the things that were left out of the Senate package, including the Open Act, Patient-Focused Impact Assessment Act, and the goal is to make sure that those get heard during the April 6th hearing. Looking down the road, we also have Scott with us, who's going to talk about a new bill that's been introduced in the House called the Rare Disease Fund Act. And then we'll, again, hear more about the caucus as well.